Hello, thank you for choosing Thomas Jefferson University Hospital for your upcoming surgery. My name is Anne Marie. I am here today with other members of our care team to share with you some important information about your upcoming total joint replacement surgery.
You will receive a call from a member of the Patient Testing Center staff to set up a time for a nurse screening call. For the screening call, you must have available a list of all the medications that you currently take, including all prescription medications, over-the-counter medicines, vitamins, and herbal supplements. During this call, the nurse will enter into your electronic medical record some of your health information, such as any allergies that you may have or medications that you take. During the screening call, the nurse will make your patient testing appointment. For this appointment, you will need to bring your photo ID and insurance cards with you. During this visit, you will meet with the nurse practitioner to review your medical history. You will also have an electrocardiogram or EKG and blood work done. Please make sure to bring a current list of your home medications, including all prescription medicines, over-the-counter medicines, vitamins, and herbal supplements to this appointment. You will receive instructions about any medications that need to be stopped prior to your surgery. You will also be told which medications you need to take the morning of surgery. If you do not receive a screening call 3 weeks before the date of your surgery, please call the Patient Testing Center nurses at 215-955-0119. If you are taking any medicines for pain, please discuss this with your surgeon. Together, you can decide if this is the best medication for you to take prior to your surgery or if there is another medicine which may be better.
We recommend that you plan ahead and arrange for a family member or friend to pick you up and take you home when you are discharged from the hospital. The physical therapist will teach you how to get in and out of a car safely. Before coming to the hospital, you can do some things to prepare your home so that your daily activities will be easier and more comfortable after your surgery. These suggestions may help you. Place the telephone in a convenient area, such as near your bed or chair. Prepare food or purchase easy-to-prepare foods. Rearrange your kitchen so that food, pots, pans, and cooking utensils are easy to reach without bending. Place shoes, clothing, and toiletries at a height where you can reach without bending. Remove or secure any throw rugs or extension cords so that you will not trip on them. Use a non-slip bath mat. Borrow any available equipment from family or friends, such as shower seat, cane, or walker. Prior to your surgery, you will need to clean your surgery site with a special product. Your surgeon's office will provide you with instructions on how and when you should do this. This cleansing product will reduce your chance of getting an infection. If you develop a rash or skin irritation, it is important that you notify your surgeon's office.
You need to bring the following items with you when you come to the hospital: your insurance card, medications that you take, including all prescription medicines, over-the-counter medicines, vitamins, and herbal supplements. Please make sure that your medications are in their original bottles. We ask that you bring these with you in case we have any questions. Once we verify your medications, they will be sent home with your family member. A small overnight bag with personal items that you feel will be important to you during your stay. A few loose-fitting outfits, sneakers that are easy to put on and take off. Please follow the directions provided to you at your pre-admission testing about eating and drinking the night before your surgery. Remove all of your jewelry and leave it at home. This includes wedding rings, body piercings, and pieces that need to be unscrewed. On the day before your surgery, you will receive a phone call between 2 p.m. and 5 p.m. from our admissions staff to tell you what time to arrive to the hospital. If you do not receive a call by 5 p.m., please call 215-955-1805 to find out your arrival time. If your surgery is scheduled for a Monday, you will receive the call on Friday.
You may brush your teeth the morning of surgery, but do not swallow the water. Do not apply makeup, do not wear contact lenses, leave large amounts of money and valuables at home. Please take any medications that you were instructed to take on the morning of your surgery with a small sip of water. Please provide enough time to arrive at the hospital and park. When you receive your phone call on the day before surgery, you will be told where to go when you arrive at the hospital. You may be asked to stop in the admissions office on the 10th Street side of the first floor of the Gibbon building, or you may be asked to report directly to the same day surgery unit in room 9410 on the 9th floor of the Gibbon building. You will wait in room 9410 before being taken back to the preoperative holding area. While in the holding area, your nurse can answer any questions that you may have and will keep you updated as to when you will be going to surgery. You will also meet with the anesthesiologist during this time. While we want to get you to surgery as quickly and efficiently as possible, please be assured that during this wait time, we are making preparations to optimize your safety and well-being while in our care. Also, please realize that the planned time of your surgery is not exact and that a number of factors may result in your surgery starting earlier or later than planned. 1 or 2 support persons may come with you the morning of surgery. Please leave all valuables such as electronic devices or money with your support person. A nurse will direct them to the surgical family waiting area located on the 8th floor in the Gibbon building in room 8210, where they can wait during your surgery. Typically, the doctor will call there after your surgery to speak with them.
After your surgery, you will be taken to the post-anesthesia care unit, or PACU. You will stay here while you recover from the anesthesia that you received. While in the PACU, your nurse will monitor your vital signs, which are your blood pressure, heart rate, temperature, and respiration rate. Your nurse will also check your dressing and the circulation and movement in your toes, feet, and legs. During this time, you will get an x-ray of your new joint. Recovery time varies per person and may take several hours.
Once you have recovered from the anesthesia, you will be taken to your assigned hospital room. Here, your nurse will examine you, take your vital signs, check your dressing, and the circulation and movement in your toes, feet, and legs. Your nurse will also show you how to operate the nurse call bell, bed, and TV controls.
Your safety is one of our top priorities. We ask that you do not move around your room alone. If you would like to get out of bed or up to the chair at any time, please call your nurse and wait for help. If you forget to call for help, our beds and chairs are equipped with an alarm that will go off and alert us as you begin to get up. If the alarm sounds, we will enter your room as quickly as possible to assist you. Please let this alarm serve as a reminder to you that you should not get up alone.
After surgery, your diet will be pretty basic at first. Ice chips, clear liquids, broth, tea, juice, and Jell-O. Please tell your nurse if you experience any nausea or vomiting. We have medications that we can give you to help with this. You may start eating solid foods when you are able to tolerate them. Please ask your nurse if you have any questions about your diet. An intravenous line or an IV in your arm will give you fluid to help keep you hydrated. It will be stopped soon after surgery. You will also receive an antibiotic through your IV to help reduce the risk of infection. The IV should not be painful. If it is, let your nurse know so that it can be checked.
After surgery, you will have a dressing that covers your incision. Your nurse or surgeon will talk to you about the dressing and when it will be removed. You may have surgical adhesive, staples, or glue along your incision. If you have staples or sutures, your surgeon or nurse will tell you when you will need to get them removed. You may shower as soon as you feel ready. Gently pat dry your incision when you are done. Do not scrub or rub your incision. Do not apply any creams or ointment onto your incision unless you are told to do so by your surgeon.
There are many ways that you can help to reduce your risk of developing blood clots. Walking as soon as possible after surgery will help you to recover and will also reduce your risk of blood clots. Wearing your compression boots when you are in bed or when sitting in the chair is another way to reduce your risk of blood clots. You will be given a blood thinning medicine while you are in the hospital, and you will continue to take this medicine when you get home. You must continue to take the blood thinning medicine for the entire time that it is prescribed to you by your surgeon.
Some pain is to be expected after joint replacement surgery. We will do everything that we can to keep you as comfortable as possible. Your surgeon will order pain medicine for you. Please make sure you ask your nurse for pain medicine when you need it. Do not wait for the pain to get severe before asking for pain medicine.
Therapy plays an important role during your hospital stay. Our goal is for you to be as independent as possible at home. We will teach you and your family safe ways for you to get around, both in your home and community. Walking is crucial to your recovery. It is the most important exercise after surgery. We will also teach you exercises that will help you with strengthening and movement of the joint. On the day of surgery, after the numbness wears off in your legs and you are able to move them, you will likely be evaluated by a physical therapist or an occupational therapist. The therapist will decide whether a walker, cane, or crutches will best help you to accomplish your goals. If you do not own a device, we can issue one to you before you leave the hospital. Insurance companies usually cover one device every 5 years. Depending on your insurance, you might have to pay a part of the cost. Prior to surgery, you may want to contact your insurance company with any questions that you have about the coverage of equipment. A therapist will work with you 1 to 2 times a day while you are in the hospital, either in your room or in the therapy gym. As you make progress, you will practice walking, stair climbing, getting in and out of a car, and moving around in the bathroom to help get you ready for home. Depending on your surgeon's preference, you may be given an exercise program to take home, or you may have other services after you are discharged. After therapy, you will be prepared with the tools and strategies that will help you to safely transition into your home environment.
Every patient is unique. The number of days that you will spend in the hospital will be based on your progress after surgery. Most patients are discharged directly home. Some may go to a rehabilitation facility based on the recommendations of the surgeon and therapists. If necessary, our case managers will arrange for your stay in a rehab. Before you are discharged from the hospital, you should be able to walk with a walker, cane, or crutches, be independent with self-care, have minimal discomfort.
When you are ready to leave the hospital, your nurse will review your discharge instructions with you and give you a printed copy of them to take home. Please make sure that you understand these instructions. Your nurse will be happy to answer any questions that you have before you are discharged. Remember that activity is an important part of your recovery. Continue to use your walker or crutches to walk as much as you would like. Make sure that you continue to do the exercises that your physical therapist taught you while you were in the hospital. You will continue to take blood thinner medicine when you go home. Your nurse or surgeon will review with you how long you will continue to take this medicine. Remember that you can always call your surgeon's office with any questions or concerns. You should call immediately if you experience any of the following symptoms: increased redness, swelling, warmth, or tenderness of your operative joint, drainage from your incision, or persistent fever. You should have already scheduled your follow-up appointment with your surgeon. If you do not have a follow-up appointment, please call your surgeon's office to schedule your appointment.
The phone number for your surgeon's office is 1-800-321-9999.
Thank you for choosing Thomas Jefferson University Hospital for your upcoming total joint replacement surgery. We hope that you found this information valuable and that it helped to ease any concerns that you may have. We are excited for the opportunity to provide you with outstanding care.